administration under the themes agenda. And as you well know, we fit into the H, which is the second pillar of health and environment. And we work very closely with the Ministry of Environment because we defined our health agenda as the One Health agenda. And as human beings, you're only as healthy as your environment. And so if your environment is unhealthy, then we are unhealthy as human beings. So it's important that we adopt the WHO paradigm of One Health agenda. Our environment, what we eat, are all significant contributors to our well-being. And therefore, the One Health paradigm is a tripod of paying attention to the health of our immediate environment, the water we drink, the air we breathe in, and to the food we consume through the Ministry of Agriculture. So let's focus on this briefing. Our health systems is built up of leadership and governance, human resources for health, information systems, access to medicines, health financing, and service delivery. And overall, these are all geared towards the delivery of responsiveness, sound health systems, social and financial protection against threats, and improved efficiency in total around the healthcare delivery. Our leadership and governance structures are as described: LASHMA, HEFAMA, our Primary Healthcare Board, Health Service Commission, Traditional Medicine Board, and we've established, as you know, the Incident Command Structure for COVID-19, and the Incident Commander is no other person than Mr. Governor Babajide Sanwo-Olu. We've also established what we call the Grants Management Office, which is to collaborate relationships and partnerships between our developmental partners to ensure that we maximize the efficiency of donor funding into the state and ensure fiscal and fiduciary standards to give our partner donors the confidence to partner with Lagos State in the overall objective of building sound health systems. Our service delivery runs across 3 sectors of health: the tertiary, primary, and secondary. And we ensure that we have access to essential supplies of medicines throughout our health facilities and reposited in the health consumable stores within the central location in Oshodi and across the 20 LGAs. We have developed a new project called the Health Information System. It's called the Lagos State Smart Health Information Platform, or SHIP, in an attempt to be part of the Smart City Initiative of Lagos State, which is part of the themes agenda. We have adopted a strategy to digitalize healthcare delivery to ensure that we are able to deliver health at a smarter, faster, and cheaper rate. This was launched about 3 months ago, and we're in the process of developing platforms that will be the bedrock of the Smart Health Information Platform. In addition, we've digitized the state's response to COVID-19. This is in an effort to ensure we have maximum control over our data, because data is vital in defining the strategies and the mechanisms for the state's response to COVID-19. In terms of our health financing, we've launched the Lagos State Health Insurance Scheme, and we have empaneled or enrolled all state civil servants as we speak. We have also started to develop voluntary enrollment into the insurance scheme. And as you know, this insurance scheme is mandatory. But as the population of Lagos gains confidence in the Lagos State Health Insurance Scheme, we will begin to make a more aggressive campaign towards ensuring that every resident of Lagos is enrolled and empaneled in the Lagos State Health Insurance Scheme. To support the Lagos State Health Insurance Scheme and to improve the efficiency of healthcare delivery, we've also launched the first statewide telemedicine platform called EcoTelemed. And this was launched during the COVID-19, and it is very much part of our strategic delivery of care. As you can imagine, consulting by telemedicine is fast, efficient, and also reduces the contact between healthcare delivery team and patients, thereby reducing the risk of infection of our healthcare professionals. Our COVID-19 response is built on 8 pillars. The first was the launch of the Incident Command System back in February, even before our first index case. We had started to prepare aggressively for the importation and arrival of COVID-19 into Lagos. To support the incident command structure, we cascaded the governance of COVID-19 response down to the local government through our rapid response teams, which operate at grassroots level. We continue to upgrade our infectious disease facilities. We've engaged several times with partners and private sector. Right now, private sector are engaging government in a very bilateral form of activity to ensure that the private sector, both in the sector of the laboratory and in the sector of healthcare delivery, are participating fully in the state's response to COVID-19. We've increased our testing capacity dramatically. We're now able to test up to 2,000 tests per day, and that number will increase as we encourage qualified and accredited private sector laboratories to participate in the COVID-19 response. Our case management is still managed through containment and contact tracing, and as you know, we went through a lockdown period, and for now, our latest strategy is to develop an integrated case management approach whereby positive cases of COVID-19 are managed both at the central isolation facilities, and those that are asymptomatic or mild will be managed in the near future in community in their respective homes. This strategy is being developed at this point in time. We are yet to roll it out. We're still in the phase of active community engagement and stakeholder engagement to define the roles and the parameters of such a strategy. As you know, the COVID-19 is expanding with active community transmission, but our profile in Lagos seems to be somewhat different from the profile of COVID-19 that you see in Europe and America, and we find that majority of our cases are mild or asymptomatic. We do have a smaller number or percentage of COVID positive people who develop moderate to severe or even critical disease. And it is this category of people and patients that we would like to bring into our isolation facilities to ensure that they get optimal medical attention and we rescue them from the severe complications of COVID-19. So our leadership divided into boards, policies, strategies, and planning, and currently the COVID-19 response. I've been through the boards. Our strategy is the 2020-2022 medium to long-term strategic plan for the state, which has several dimensions to it, including infrastructure, human resources for health, financing, and biosecurity. So our human resources for health is being managed across several sectors. Essentially, our training takes place at the Lagos State University Teaching Hospital and the Lagos State Nurses Institutions through the Lagos State Ministry of Health, Health Resources Unit, the Health Service Commission, and down to the level of family medicine at the Primary Healthcare Board. LASUTH has expanded its resources. It has increased its complement of staff, recently employed 105 new house officers, 33 additional consultants, and 157 resident doctors. This is in keeping with our plan to ensure that we improve the environment in which our health care professionals are working and that they're not overburdened with duties, which makes it, which creates the climate for us to see flight of doctors and healthcare professionals from our shores. So we're trying to increase the number of healthcare professionals within our facilities, improve the facilities themselves, increase the training that we provide for them, and generally improve their welfare packages such that we retard the well-acknowledged brain drain phenomenon that we are experiencing across Lagos State and across the countries. So our human resources for health, we've increased our healthcare professionals by 1,050 across the public, primary, and secondary and tertiary facilities. We've also been able to increase and develop 50 selected senior healthcare personnel for leadership and management positions, both with our partners abroad and internally. We continue to deliver continuing medical education through our Health Service Commission, especially for the large number of healthcare professionals we have in the Health Service Commission secondary health platform, and also across the primary healthcare platform. So I've just alluded to the increasing training by the Health Service Commission, and we are also in the midst of the outbreak where we've trained over 1,500 diversity of medical cadres that are responsible for the COVID-19 response. The training was conducted by the Health Service Commission between March and the 1st of May, and we now have at our disposal over 1,500 personnel that can be deployed to the isolation facilities and to the primary healthcare platform that we are about to include into the COVID-19 response. We also have trained 50 intensivists who are positioned now to take care of the complications of COVID-19. We're beginning to see an increasing number of patients who are developing certain systems failure, particularly respiratory failure, and therefore we developed high care facilities across our isolation facilities, and they're being manned by these intensivists that have also been trained to look after patients who are in distress, especially with respiratory difficulty. So we've recruited new personnel across both the primary healthcare platform. In the last 6 months, we've added 1,044 new recruits across the different cadres of healthcare professionals in the primary healthcare structure. As you know, we have over 300 primary healthcare facilities delivering a variety of levels of care to our primary healthcare platform. 65 of these platforms have undergone rehabilitation through the development of increased availability of essential drugs, and also for the development of emergency preparedness and infection control. We've equipped some of our higher levels of higher institutions with very advanced technology. This, for example, is a very sophisticated ophthalmic equipment that was installed at the Lagos State University Teaching Hospital, which is increasing our capacity to deliver sophisticated eye treatment to the people of Lagos State. In addition, we've developed a high caliber urology facility which is to take care of problems within the bladder and the urinary system, prostate, bladder, and all the all the conditions that are associated with the urinary tract. We've also installed extensive CCTV coverage across many of our hospitals, and we have installed ventilators in numerous of our hospitals, including our isolation facilities. In the last 6 months, you are fully aware of the commissioning of several projects. We commissioned 2 mother and child care centers. The first one was at Etiosa. Earlier on, in September of 2019, we also commissioned one in Alimosho, and we're developing 2 new ones in Badagry and Ekwe, which are going to be commissioned in the next couple of weeks. So that will be a total